Hello, everyone. My name is Dr. Richard Horowitz, and I am your co-host today of the Doctor's Talk Healing from Lyme Summit. And it's my great pleasure to introduce to you today Dr. Amy Dirksen. Dr. Dirksen is a competitive athlete and naturopathic physician with a full scope of practice in Washington State since 2003. She did undergraduate training in biochemistry, and we're going to be discussing some of those really interesting biochemical pathways with Amy along the way that many of us, I think, would be confused about. And she did her undergraduate training and postgraduate training with Dr. Klinghardt. She has additional training in PANS PANDAS. She's trained with ILADs, mold, genetics, methylation, LDA, LDI, really kind of a broad range. So, Amy, tell us a little bit about yourself and how you got into Lyme and in fact, even why naturopathic? I get it as an MD because I had to learn the naturopathic approach, but why don't you just tell us how you got into all this?
Oh man, big question. So, I always thought when I was growing up that I wanted to be a surgeon, but I have terrible hands. And I was actually pretty sickly myself. I was an athlete. I had a ton of energy, but I would get pneumonia every year and miss, a couple weeks of school. So anytime So when I was in college, I had an injury. Their solution my senior year was, okay, more ibuprofen when I tore a hamstring, and I guess you're not going to run again. And I turned to an alternative book and found out I was deficient in calcium and magnesium and took the cheapest supplement I could afford because I was totally broke. And within 3 days, after 3 months of pool training, I was back to running again and feeling good. And so I realized, there's something more out there. And I was lucky enough to have a class in college on alternative medicine, and it blew my mind to even know it was out there because I hadn't been exposed to that. So I was fortunate enough. I lived in an area where Bastyr University is and had that as my original thought was to go there, just get an understanding of what's contributing to illness, right? So it's not about the diagnosis. It's about why are you sick and what's the big picture? And that really fits with how my brain works. And so it's been fun detective work. The 20 years of my career, I was really fortunate. I started with Dr. Dietrich Klinghardt. And so I didn't have to reach matter if you're rolling in a wheelchair or you're running in across a finish line. There are layers that we're all impacted by.
Right. So that's great. And by the way, I like affectionately to refer to myself as an MD also as a medical detective, because ultimately what most of us end up having to do is to unlayer these illnesses, right? It's
Right.
not about the classical medicine approach of name a disease, throw a drug at it. It's really about unlayering it into the component parts to figure it out, right? So great.
Absolutely.
So today's topic, which I think will really be helpful for people, we're going to be talking about solutions for chronic fatigue, right? And those who are suffering from Lyme and associated illness. And it's perfect for you because, right, I also, by the way, loved biochemistry. My medical school in Belgium was 2 years of functional biochemistry.
Oh, wow.
Yeah, so I actually wrote up on the walls. I had colored pens. I don't know if you did this. I was writing out all the Krebs cycle and all of the stuff in pens and colored pens. And so I could memorize it that way. I write it all out. And I loved it also. I thought it was absolutely fascinating. So,
Oh yeah. I blew up a big chart on the wall and had it laminated so I could write little notes of like, okay, where the nutrients fit in and all of those things. So
yeah, great.
one
So
geek to another, I appreciate you.
No, of course. So tell me a little bit, how does chronic fatigue and Lyme differ from other chronic fatiguing illnesses? How do you think, where are you seeing the differences and the different approaches of what we have to take here?
It's just exaggerated, right? So a lot of times when you're dealing with Lyme disease, it's been this fatigue that came on sometimes out of nowhere, or it's crept on really slowly. You feel older than you are. That's usually one of the first complaints if someone hasn't identified that they've, been dealing with a chronic infection. They're just like, I don't know, something's wrong. My doctor tells me I'm fine, but I am so tired, and it will ebb and flow. Typically, your baseline is more tired than they used to be, but there definitely tends to be a more cyclical pattern to it when there's an infection related.
Right. And that's, by the way, and that's an important one because the symptoms coming and going with good and bad days is really the hallmark, right, of chronic Lyme, where you would expect maybe with long COVID, you're not going to have that same cyclical nature as much, right? Because maybe the mitochondria get affected, so they're tired every day, right? It's a little bit of a different clinical picture,
Yeah.
right?
Definitely presents a little differently. So again, when you're thinking about it, you're just looking for those clues.
Great. And the markers are indicators, right? That someone's fatigue is due to Lyme versus, right. And we're going to talk about all the different forms of inflammation of where people get sick and the downstream effects. But what are the markers you look for yourself when you're trying to figure out if someone has Lyme disease?
If they have Lyme disease, so it, I kind of see this as two questions. When you're looking for if someone has fatigue, it doesn't matter if it's Lyme or not. I'm always looking at just on basic labs, like a homocysteine level. What's the size of their red blood cells? Is the MCV on the big side? There might be a methylation issue there. Is the cortisol really low or is it sky high? Are their hormones totally in the tank before you think they should be? Maybe that DHEA is crazy low. For a lot of women, progesterone's dropping and cycles get weird. Lyme markers, we can look at a CD57. We can do fancy Lyme testing. There are other people who will be talking in the summit who definitely will be focusing on that. So that is where your detective work comes in. And I think looking for some of those markers is important. Is it an IgG or an IgM or, kind of what level of inflammation are we seeing? So you can do a CRP level, a SED rate, some of the cytokines if you want to be fancy, but there are labs that you can do that are covered by insurance, which can be really nice.
Right. Do you tend, I mean, I think a lot of the docs who work with these kind of patients, do you use IGeneX laboratories, and these are immunoblots generally?
I do.
Yeah, I mean, for us,
too.
it's pretty much first line. And of course, I have no financial, relationship
Right.
with them. They're just a great lab. But what I usually tell people is I play Lyme bingo, where, bingo, any one of these following numbers, 23 OSP-C, 31 OSP-A, 34 OSP-B, 39, 83, 93, bingo, you've been exposed to at least a Borrelia species, right? So
Right.
then I just have to figure out if it's due to that. And do you see the migratory pain? When I published my questionnaire years ago, we found migratory pain was associated with Lyme, whether it was muscular, joint, or it was nerve pain. Do you find that in your patients too?
Yeah, I saw that more 10 years ago than I'm seeing now. I'm seeing it more static now than this migrating pain. But I'm also on the West Coast and I'm a last stop for people. I'm not a first stop. Right. So I'm not tending to see the acute Lyme. I'm tending to see the person who already knows they have Lyme and they're stuck because I do a whole system of muscle testing and everything I learned from Dr. Klinghardt to figure out, okay, what else is going on here?
Right.
But definitely the weird, I just think of a young girl I'm treating right now. And the biggest clue, because we're trying to figure out with her, is this a head injury or is this Lyme disease? Right. Because she has these really severe headaches. And then all of a sudden she started having this migrating body pain. You're like, oh, all right, this is Lyme. This isn't the head injury.
Right.
Yeah.
And of course, and I'm sure you see the same thing. There's no one in my practice who comes in with one thing wrong with them, right?
Right.
The analogy I use is you go to a doctor with 16 nails in their foot and tell the doctor you have a foot pain, and the doctor takes one nail out and says, come back in a month and tell me how you're feeling, right? In our world, it's usually multiple inflammatory triggers and multiple downstream effects, right?
Yeah, absolutely. And especially as time goes on, I was just reading Steve Harris's book that he's about to publish, and he was even talking about how much more difficult it's gotten in the last 10 years. And I've seen the same thing. Like there's layers and layers of inflammatory issues and a lot of gut issues that I'm seeing becoming really exaggerated that I feel are contributing to this.
Mm-hmm. What are the gut issues specifically that you're seeing in the practice, or the immune issues that you're seeing that are affecting these chronic fatiguing patients?
Yeah. So the biggest change I've seen, because as a naturopath, we talk poop immediately. That's just how it goes. And so I've been doing stool testing for 20 years now. And it used to be really abnormal to have an abnormal IgA level. So normally you think if IgA is low, we're seeing leaky gut, or if it's really high, I think of it like this overactive immune system response, and you would rarely see that. But now I rarely see anyone in the normal range.
Mm-hmm.
And so that's telling me, okay, our immune system is really activated or suppressed. There's a multitude of things that could be contributing to that, but clearly it's happening.
No, and we see exactly the same thing. In fact, I would say almost every patient now coming to us has leaky gut. And food sensitivities with some mast cell activation. I don't run the GI map, as much, or CDSA, but certainly I'll see, too much Prevotella or Clostridium or not enough Akkermansia. Do you run the GI map or CDSA? You're finding some of those helpful?
Yeah, I am finding them helpful, but it depends on someone's budget as well. So, if they can't afford a test like that, there's a lot of tests you can do, just a stool test with LabCorp or Quest, looking for like calprotectin and white blood cell count and, eosinophils in this stool just to get a general idea. You can do Clostridia markers if there's all of a sudden aggression that seems to be going on. I do like the GI map. It does paint the picture for me. And I would say that IgA level tells me a lot, especially if it's early in my treatment. If that IgA is low, I know I need to boost that gut immune system and overall their immune system. I also just look at a CBC. Is that white blood cell count low, or does it tend to run high? Because if the IgA is high, I know I need to down-regulate things for them, right? I'm not going to use mushrooms and immune stimulants. That's going to completely backfire on us.
Yeah, and also because you brought up COVID earlier, I mean, we're seeing in some of these patients, I wouldn't say earlier on in my career, I was checking natural killer cells, T cells, CD4, CD8, but now we regularly check them as well as checking immunoglobulins and subclasses. And there's clearly, the COVID overlap at this point is definitely making things a lot trickier because even though many of the patients do get treated early, with Paxlovid and all the things we do with glutathione, and, we can talk about some of that. Yeah. Nevertheless, I mean, I think the viral overlaps are becoming much more difficult now with fatigue because you're getting Epstein-Barr reactivations in HHV6. So you're also seeing those kind of viral reactivations?
Oh my gosh, and I'm seeing a lot of varicella activation as well. So if all of a sudden, if someone's symptom during COVID was that shooting pain, or if afterwards they're just having this deep burning sort of pain, it's very likely varicella that we've seen activated. I've seen a lot of influenza getting activated as well, even if someone wasn't exposed, but I'm definitely seeing Epstein-Barr with the fatigue getting reactivated for people.
So what is the panel? I mean, because we're talking today about addressing the chronic fatigue, which is obviously one of the worst symptoms that people have. So, when I think about it myself, and you mentioned it earlier, I'll always check the hormones because the HPA axis gets downregulated, right? You can get the adrenals that are lower, sex hormones that are lower. Many are getting POTS, right? Low blood pressure from both COVID and from Lyme. But we're also seeing, of course, that I'm seeing a lot of parasites with Babesia, and I'm seeing Bartonella, right? It's really becoming almost like every factor these days seems to be causing fatigue. So how do you kind of do your checklist? When you're seeing a patient for the first time, how do you look at that?
Gosh, that is a great question and could be a whole class in and of itself, right? Where do you start with the chronically ill patient? I think the most important thing is you do a thorough intake and you listen to their story and you really listen to their symptoms, and that you don't go in with goggles on thinking, okay, this is Lyme, COVID, or whatever this is that you really listen to the whole picture. Are they attempting to do some exercise and they're wiped out for 3 days? That's probably a mitochondrial issue, right? Do they not handle oxidative stress at all? Did they try ozone and it blew them out of the water? Do they not handle antibiotics? Do they not handle some of these things? Just really listening to that picture. I tend to run labs. So I really love an organic acid test, which is a urine test, because it'll look at markers of yeast and bacteria in the gut. It will look at our methylation markers. So all of our good B vitamins. It gives me some good mitochondrial markers. It will look for markers of ammonia and oxalates, which are two things that can really contribute to symptoms, brain fog, pain. It will look at glutathione and toxicity markers. So one quick little urine test, especially I tend to treat a lot of kids, so it's nice if we can avoid a needle, can give me a ton of information. So a lot of times we'll order that before they even come in. And then I like to start with standard blood work that is covered by someone's insurance, because as we all know, this gets incredibly expensive to deal with, right? Because a lot of times people aren't able to work. And then you have all these supplements and medicines and copays, and it just adds up really quick. So, there's a ton of things we can look at, and I'm happy to share my list of labs, or we can get into that a little bit later.
Yeah, no, we'll get to that in just a little bit. And, and you brought up a really important point, which, we as healthcare practitioners know, but 90%, right, of the answer is always in the clinical intake. And you said it, like, if someone says, I take antibiotics and I'm a lot worse, the question is, was that a Herxheimer reaction? Or maybe you have candida, right, in your gut, and you're flaring it up, because a lot of these patients who've been on chronic antibiotics, they have a candida issue. We find maybe 10% when they're done with antibiotics, we clear them out for yeast and they go, oh my God, my fatigue and brain fog was, not from the Lyme or the BARD anymore. It's actually from candida. From the candida, right? Or mid-morning or mid-afternoon, doc, I start yawning, I get really tired. Well, your metabolic syndrome? Is your blood sugar swinging, right? It's
Mhm.
taking that history, right? That really is, or do you have day sweats, night sweats, chills? Is Babesia present?
Right.
So you're right. It's old, and I don't know how long your intakes take, but usually when I see a new patient, it's hours, right,
Yeah.
to get that
Yeah.
intake.
My first appointment for me is usually 2 hours, and we are rushing to get through that. Yeah.
Right, right.
Yeah.
So no, I think it's important. Now, these organic acid tests. I mean, I know there's a lot of labs out there, and unfortunately, in New York, like the O test and some of these, I can't always get. What labs do you like for the organic acid test?
So it used to be called Great Plains. It's now called Mosaic. So that's been by far my favorite of the organic acid tests, and the only one I
Okay.
use. Yeah.
Yeah. So, I'm wondering in New York, they've got this thing called anylabtest.com. I'm wondering if my
I
patients tried it. Have you tried getting it sometimes when patients can't get it from like whatever state they're in?
I've had the luxury of, I fly under the radar and I'm in Washington, right? So as an ND in that, you get a lot of things, and I just carry them in my office and send them to people. I don't have a lot of patients from New York. I have patients from all around, but not a ton from New York. Often they'll have an alternate address. I shouldn't put that on video, but often they'll have something else that we just put in as their base address if that's, where they're staying.
Right.
So
Right.
there it is. But any lab test now is something to look at. Direct Labs is a place that often people can order their own. So I would check both of those because they're adding things all the time.
Great. And when you get back these organic acid profiles, and again, these are like specific biochemical pathways.
Yeah.
When you see these abnormalities, what kind of nutritional supplements, because you do a lot obviously with nutrition and diet,
Right.
can you just give us like a rough idea of what kind of responses you're seeing, like one or two examples?
Oh my gosh. Well, I mean, it depends what shows up there, because sometimes, you run an organic acid test and it is a hot mess, right? And so, it's great because there's a lot of things you can do to help this person. If it comes back and it's completely normal, then you're like, oh no, this is just the infections. We gotta target that. So, first page of that comes back, a lot of yeast and bacterial markers. I address those first, right? Because if there's a ton of dysbiosis, if they have Lyme, we're going to have to go after that. But the treatments for Lyme are just going to trigger that dysbiosis more. And that, they think 80% of our neurotransmitters come from our gut. So if we haven't put out that fire first, they're not going to tolerate any treatments. And so, if the yeast markers come up, we might look at like capryllate, undecylinic acid. We might look at digestive enzymes sometimes as just feeding that. We might look at cutting back simple carbohydrates and sugar in the diet. Or we look at prescriptions. I'm a huge fan of diflucan. We went around a round table once of like, okay, if you get 5 things to take with you on a deserted island, what medicines are you taking? And diflucan was one that we all said we would take. So, it's an immune modulator as well. So there's a lot of other benefits. For the bacterial stuff, sometimes we can get away with probiotics, like the spore-based probiotics are fantastic. Seeking Health makes probiotic histamine X. You can look at rhamnosus species or just bifidus. Bifidus tends to calm the system down. And do keep in mind that not all probiotics are created the same. I mean, that, but for everyone we're talking to, if you've taken one and it really triggered you, that doesn't mean you wouldn't tolerate others, but they are microbes, right? So like a lot of my pandas kids, they don't tolerate probiotics at all because it just triggers those funny immune reactions. I think we'll get into later, like some of the other markers for methylation. So some of the B vitamins and mitochondrial things, we can dive into that and some of the treatments that I really find helpful for that.
Amy, I'm sure people, by the way, are going to have questions after they listen to you, because obviously you've studied biochemistry. You have a really broad knowledge here. How can people get in touch with you? And do you have any upcoming webinars or seminars or things you want to share with people that you're doing?
I'm actually working on a training platform. So that it's probably more than a year out for that, because I'm working with Dr. Talia Hale, and we're trying to train physicians and patients on the big picture of things. Because there's only so much you can get out of a patient visit, even a 3 or 4 hour visit with your doctor. There's so much intake, and there's only so many things that they can educate you on. You can reach me. So holistichealingarts.org is my website. So you can see lots of information and get scheduled with me there. Is how to find me now.
Great. Thank you. Yeah. All right, so let's dive back in a little bit again, because I think because of your expertise again in biochemistry and pathways, it's interesting to kind of look at these markers that show up on these organic acid tests. So, for example, You may not always see, for example, lactate and pyruvate and ammonia. We're talking about
Right.
them, right? Mitochondrial dysfunction. So there's a difference, of course, between inherited, right, and those people who actually just get too much free radical oxidative stress from tick-borne or from viral infections like COVID. So
Right.
can you talk a little bit about those markers and maybe nutritional supplements, things you like, and then we can maybe go through some of these pathways like the methylation and stuff to just tell people some of the supplements that you found can be helpful.
Yeah. So, okay. So let's start with that. So the markers for mitochondrial issues versus oxidative stress, is that what you're asking?
Yes.
So mitochondrial issues, a lot of times you can check if you want to on blood work, you can check acyl carnitine. You can look at a plasma amino acid level is a really nice one, and look at the alanine to lysine ratios. Those can actually give you quite a bit of insight there, even if everything's in the normal range. Like you were saying, lactate and pyruvate, they tend to be the points that back up, right? So if those are high, we already have some indicators there of what's going on, and those do show up more. That and succinic acid tends to show up more on the organic acid test. And even for those of you who don't know biochemistry, an organic acid test, especially, so not one that you would order from just kind of a standard lab or LabCorp, Quest, those sort of things, but one of the fancier panels, it really will lay it out for you nicely. Like it'll give a whole visual section of mitochondrial markers, and you're just looking in general, is the pattern that all of your markers are falling out of the normal range, like they're looking high. So they have this nice little band, right, of the 2 standard deviations from the mean. And if you're like tend to have a lot of markers outside of that, you're already thinking, okay, this is mitochondrial stuff. The symptoms that are going along with that are really poor recovery, right? So a lack of stamina, sometimes loss of muscle mass. But really that like sometimes I see air hunger with that, but you just are wiped out. You do a little bit of something. Like I personally went through this recovering from COVID, is you take 1 step forward and then 2 steps back. You attempt to do a little something, you get up and take a shower, and then you are wiped for days sometimes. And so that's a mitochondrial thing. Simple treatments for that, acetyl L-carnitine is so helpful. So the thing I really learned, and I think this is a good tip for people to know, is when you're addressing mitochondrial issues, mitochondria are greedy, right? They're in all of the cells of our body. And so if you're taking something by mouth, the first cells to get that gut, right? And then anything it comes into contact with. So you have to make sure you do a high enough loading dose to actually replenish the mitochondria and the adrenals and the nervous system and the rest of the body that really would have the impact on stamina and energy. And so I learned early on, I read about all these things. I put people on acetyl carnitine or some of the research nutritionals products, and I was like, man, they're not working because I wasn't dosing high enough. And so I typically tell someone, if they're going to start it, it is a commitment, and we want to make sure we stick to taking it daily and going high enough. So on carnitine, you may have to tiptoe into it because someone who's really depleted might feel more depleted when you get it started. I'm sure that you've seen that. And so, I might start with, 500 or 800 milligrams a day, but I may work them up to 3,000 milligrams a day. There is a prescription Carnitor that sometimes is covered. Otherwise, can we talk name brands of things?
Yes, of course.
Yeah. So Designs for Health, their acetyl L-carnitine is my go-to. It's a little more expensive, but I've got to say that one has worked for whatever reason. It's an 800 milligram. I typically like to get people up to 3. So normally 2 in the morning, maybe 1 midday. The other thing is CoQ10. And I find our Lyme patients, they are so oxidatively stressed because mitochondria are vulnerable to oxidation, right? So that's what's harmed them in the first place. I do 400, maybe even 800 milligrams a day of CoQ10 with people.
And that, by the way, that's the dose I'm using also that I'm finding effective.
Good. Yay. So
yeah, it's exact. And at least 2,000 of acetyl L-carnitine. If they're eating some red meat, they're getting some carnitine anyway from it. But yeah, no, I'm tending to go higher on it also. And I like the Design for Health. I also use the Mito NR. I've been using that one with the nicotidoside riboside. I've been using that one. Yeah. And even the MitoPrime from Zymogen that helps to regenerate glutathione. I've found that for some people, I think it's been helpful also.
Yeah, the Zymogen products for mitochondrial health have always been really good ones over the years. A little more expensive, but definitely effective. And that's the thing, is sometimes the price is worth it if it's going to work, rather than just pouring like lots of stuff into your body. The CoQ10 I like is Research Nutritionals. They have that CoQ10 Power, which is 400 milligrams each, a pill that's pretty easy to swallow. That one seems to work really well. I think of CoQ10 also with a person who tends to get headaches, like if they've done ozone therapies and they get a wicked headache afterwards, CoQ10 is a really great rescue for that.
Mm-hmm. Right. And the only place I have to be careful with it is if they're on Mepron or Malarone and I'm treating Babesia, because the CoQ10, right, it interferes with the pathways, right?
Right. And so typically with that patient, I'm sure you do the same thing, is I load them up on CoQ10 before they would start that therapy. And if we have to take a break, because, for a couple of days, even sometimes I load it up then during a break.
By the way, do you find the ribose cardio, do you find, using ribose also makes a difference in some of these medications?
Ribose can make a big difference. It's not my first step, but often a second or third step. Ribose cardio, so you're referring to that product from Research Nutritionals. Yeah, it's a good one. So sometimes a little gut stuff with it. So I see some loose stools at first. So with any of these things, usually I start a little bit low and have them work up over a week or two. Just give them a heads up, it might loosen your stools right at first, and then your body gets used to it. But the ribose definitely helps. I like to do that before any sort of exercise. And exercise might look like, okay, you're going to go to the grocery store today. That might be your version of exercise. But whenever you're going to start to push yourself, the ribose can definitely help. Alpha lipoic acid is also incredibly helpful. For some, we have to be careful with someone with a heavy metal load like that may mobilize some things, but for most people, alpha lipoic acid has also been really helpful.
No, I mean, the beauty is it regenerates glutathione intracellularly by 30%. It's fat soluble, water soluble, and it regenerates mitochondria, right? Along with exercise, resveratrol. I mean, there's a bunch of things that to help to regenerate. You've used urolithin A, the new one, the new kid on the block that's kind of come out.
Oh, I have not.
So,
what are you seeing that?
Yeah, so it just started to get released. I mean, there's part of the microbiome with the bacteria seem to produce it in some people, but in some they don't. And we were speaking to Dr. David Perlmutter just recently on this. I did it, and David actually is starting to use it himself. And I take, by the way, I take all these mitochondrial supplements myself because they're now showing it's associated with Alzheimer's disease and Parkinson's. And I must admit, as I'm getting older, it's like, I still need my brain. I don't mind if I swallow another, 5 or 6 supplements. It's already 70 per day. It's like, who cares at this point? Right? Yeah.
Yeah. So where do you get that product and how do you dose it?
500 milligrams twice a day is the usual dose of it. There's a couple of brands online that have it, but it seemed, from what I've been reading about from Kara Fitzgerald and David and others, it's kind of like, it seems like in some people, it may be a little bit of a boost sometimes when they're not getting enough help.
Yeah. There's a product called K-Pax that's been good for a few people too. It's just they had done some research. I'm trying to think, I think it's Integrative Therapeutics that makes it. There was some really great research. They had actually developed their mitochondrial product based on an HIV med that was suppressing mitochondria. So there was a ton of funding into that. And that product, I still use it. It seems to work pretty well.
So let's go on to the next pathway, because I think, revolving around the organic acid test is actually perfect for our conversation, because I don't think many doctors are really using it. In fact, I only use it on occasion, and my talk with you today is actually convincing me, even though the majority of my patients do get better with the way I'm approaching it. But it's like, that's the beauty of doing these talks, is it actually checks off boxes like, I should be doing this more often, especially. So let's talk a little bit about the methylation. You talked about homocysteine. You need some B6, B12, folic acid. Talk about the methylation markers, and clinically, what do you see? Because there's this question, and I don't see it so much, and I don't know why. I am never really over methylating. I don't believe my patients. They're not getting anxious. But when I'm doing Dapsone, I'm using massive doses of L-methylfolate. And I'm not getting these people saying, oh my God, I'm crazy, I'm so excited. It's like, do you see a lot of over methylation? And what do you do for it when you do see it?
Yeah, good question. So I saw a lot more over methylation early on in my career, and I haven't seen it as much recently. So overmethylation, if you think of your big methyl donors, so methyl B12, so that version of B12, methylfolate, more so than folinic acid, and even B6, those can be your main methyl donors. And what people will notice with that when it does happen, because I have seen it, is you do it and they feel so anxious. Like I remember doing this with my former nurse and we gave her an MB12 shot before she was ready. I thought she was ready and she didn't sleep for a couple days and she was just like on edge. I'm like, okay, so we need to learn this. And luckily I was studying with Ben Lynch at the time. And so the tricks for it, because you would think, okay, binders, all that stuff, it doesn't work. Potassium. So plain potassium, not as an electrolyte, but as like a potassium citrate. So I would do maybe 100 milligrams 2 to 3 times a day. Or you get someone regularly on electrolytes or just a single potassium a day if they tend towards that. And then niacin is a really great rescue. And they make a niacin. So niacin, we want the flushing type. I'm not looking for that flush. So if someone is overmethylating, niacin is going to mop up those methyl groups and it's not going to cause a flush. So Seeking Health makes a little 50 milligram lozenge, or at least they did. Otherwise, you can stick to maybe like 100 milligram. And you can take that every half hour until the overmethylation feeling goes away. And then your clue is, all right, this person isn't ready to handle these methyl donors. They probably need B1, B2, maybe some adrenal help, probably some zinc and probably some magnesium. And then you revisit it and I bet they'll tolerate it. Or you could try like hydroxy B12 is a great one to start with because it's not going to have that methyl donor. So that you can start to push those doses, and you could even do B12 shots with hydroxy and maybe try folinic acid.
Right. No, and I used a combination of folinic acid and M-methylfolate when I do the Dapsone protocol.
Right.
But of course, the tough part about figuring out, and I don't think I'm overmethylating, is that you get Herxheimer reactions while you're doing the Dapsone protocol. So of course, people get more fatigue and more headaches and more pain. And if they're anxious, of course, some of the underlying psych issues come out. It's a little bit tough to be able to differentiate it. What markers would you be able to see on these kind of tests to tell if someone's overmethylating? Is there a way to
so it's not going to be a marker on a test. It's going to be their symptoms. So overmethylation, they take something within a half hour, they feel like, oh my gosh, what have you done to me? Like you had a million cups of coffee and you don't know what to do with it. It is that clear. There's no test that's going to tell you that. Okay. I would say for most people, don't be afraid of overmethylating because just like you said, you don't see it. I rarely see it. And I work with a really sensitive group of autistic kids a lot of times who would tend to see that. You know, a lot of people talk about MTHFR genes and all of that. So many of us are impacted. I've actually gotten away from doing a lot of the genetic testing for that because I know methylation is compromised. Our folate cycles are compromised. Like most people benefit. You know, I'm good friends with Dr. Newbrander, and, you know, he does the methyl B12 shots and then high doses of folinic. And he was saying, you know, the results were the same regardless of MTHFR status. So
yeah, you know, I'm actually in the same place. I used to do them all the time. I don't tend to do it as much. And even the problem with the homocysteine is I get it on everyone, but I don't know why the labs, they don't love paying for it, even though it's a really important marker. At least LabCorp and Quest, we have to petition the insurance companies.
How? I haven't had any issues with that getting covered.
I'm wondering if that's Washington, because boy, in New York, when I'm doing it, they're pushing it back and making me say, listen, they've got cardiovascular risk factors with blood pressure, cholesterol. I need to know, you know, in fact, my homocysteine was 16. This is like 20 years ago until I figured out I need more methylation. So I took it, then it came down to 8 and it was like, okay, you know, we're in good shape, but I didn't know it until I started checking it myself.
Yeah. So homocysteine. So the other thing you might want to look at is negotiating directly with LabCorp for a cash pay price. I think I got our price down to, I don't know if I'm supposed to say, but like $16 or something for a cash pay.
Oh, I'm going to have to check that out because we are definitely struggling with them sometimes to get it over.
Yeah. So I'm happy you can have your staff reach out because we just went through a whole negotiation on some of these things, like markers like TGF-beta1 and some of those to really get a cash price. Because I had a bunch of people, as a naturopath, I don't get coverage for anyone of Medicare age. And so it was ridiculous. And so we had to negotiate these cash prices, and it definitely saves a lot of money.
Can we talk a little bit about now maybe the phase 1, phase 2 liver pathways on these testing? And like, are you checking glutathione in the blood? Because I have, and I've seen it actually low in some, especially in the COVID patients who've gotten worse. You want to talk a little bit about phase 1, phase 2, and what testing you like or what supplements you're using?
Yeah, we can talk about that. And just a little bit on methylation before we just focus on the B12 is the folate is really important. So sometimes you want a methylfolate or a folinic, you don't want a product with folic acid. So I would say whenever you're looking at like a multi-B, look at the form of folate in there. That's going to be your tell if this is a quality product or not. It should be methylfolate or folinic. Otherwise, the other ones are competing and blocking the good folates from crossing that blood-brain barrier. But B2 is also a key ingredient. B6 can be tricky to tolerate, but is also key. I really like Thorne's Methyl Guard Plus. So if someone's tolerating those methyl donors, it has B12, folate, B6, B2, and that's been a good one. B2 is going to make the urine crazy yellow. So just be warned of that. You're not dying. The other thing is just on the B vitamin front is B1. So the fat soluble B1 benfotiamine in high doses, maybe 100, 200 milligrams twice a day. They call it the gateway to the mitochondria, but it's also so good. I've seen it for speech. I've seen it for nerve issues, a lot of those. So if someone's really struggling on that, and if they're homocysteine, so an ideal blood homocysteine is between 6 and 8, right? So if it's higher than that, and especially if like yours was 16, I've seen people coming back, their homocysteine's 30, right? I know that that's driving cardiovascular inflammation. I know they need B vitamins before they need anything else, like that whole body pain, the feeling horrible. If we can get the B vitamins right, and a lot of times I'm having to do B12 shots, which I do subcutaneously every 3 days, over time, we're seeing a huge change. So, okay, liver, phase 1 and phase 2 detox pathways. So I got away from doing a lot of blood tests for glutathione because I was struggling to get that covered, and the lab I was using at the time, it just took forever for the results to come back. You can always look at on a chem panel ALT, if it's elevated, you need liver support, but it's normally not going to show up like that. I usually just I can look at that organic acid test again. Are there needs for glutathione? Glutathione is amazing. You don't need me to tell you. I'm sure every other doctor you've interviewed has talked about that. But not everyone tolerates glutathione. So we may have to do a step back to support those liver detox phases that are building glutathione. So I really like Designs for Health Amino Detox. It got all that phase 2 liver detox support, a little tiny bit of glutathione. NAC is actually tolerated really well and really important in the era of COVID. Helps with some of the lung issues and those things too. So high doses of NAC can be really helpful. Good old milk thistle is helpful as well. Thorne's SAT product is really nice. Himalaya's Liver Care is another one that's been really helpful. And then the other thing I also look at is bile flow, because a lot of our patients dealing with mold or biotoxins or any of these things are not excreting those toxins. So if you're someone who herxes and just stays stuck in a herx, you don't tolerate anything, we've got to, promote that movement out. So they might need ox bile. They might need digestive enzymes with lipase. You might want to start doing coffee enemas or castor oil packs to get some movement going. You might have to cut back on fat in the diet and really kind of spread that out and do these little meals throughout the day, or do something like intermittent fasting just to give a phase of rest for the digestive tract. TUDCA can be really helpful for that. Neural therapy can be really helpful for that. There's a lot of things, I'm sure. What do you like?
Yeah, I mean, we all approach it differently. I mean, I like the MedCaps TPO, the dual phase optimizers from Zymogen, because it has a lot of these things in it in one. I will use the milk thistle. They make a liver protect from Zymogen. Yeah. I've been on their board and I love their products because they're all pharmaceutical grade. But of course, all the ones we're mentioning, Thorne and Design for Health and orthomolecular, these are all great products, right? I'll even use some DIM, some diindolylmethane.
Yeah, I use a lot of DIM.
Right, and sulforaphane glucosinolate for phase 1 and phase 2. Because I don't think anyone's getting it enough of the cruciferous these days, right? Considering the cancer rates. There was just an article that young people are now coming down with dual cancers right at the same point in time. And it's kind of like the cancer epidemic we're seeing. It's like all these environmental toxins getting in. I mean, this is not just genetics in people. No. And we know the viruses and bacteria contribute to cancer too. So yes, I mean, these are things even myself, right? I use these things on myself to just keep unloading, and hopefully in the wintertime, a little bit more far infrared saunas, right? To unload the toxin levels from the body.
Right.
But yeah, those are the ones that I like myself, that I found, kind of easy and helpful.
Yeah, check out Pure Encapsulations DIM Detox. It's my supplement love affair of the last probably 6 months.
Hey, you said N or M?
DIM Detox.
Oh, DIM, D-I-M, DIM Detox.
DIM Detox. So it has a lot of the other support with that. Really great for hormone balance, really good for liver stuff. I'm finding, because I ART test everyone, So most people are testing for that product over others, but I'm seeing really nice responses in a low dose, like 1 pill twice a day.
Mm-hmm.
Yeah,
Great.
that's been a good one.
Any other pathways you think that are important as we're talking about, again, fatigue? I mean, it's interesting when I work the 16-point MSIDS map, and when I do it and I think of it this way,
Yeah.
I talk to people about 6 rivers of inflammation and 10 downstream effects. So, the rivers would be the infections, bacterial, parasitic, viral, fungal, microbiome issues, leaky gut, you're not sleeping, you don't have enough nutrition to deal with all the chemicals. Mold is showing up now in just about everybody, right?
Everyone.
With
Mhm.
heavy metals. So those are all like inflammatory factors with downstream effects, including mitochondrial and POTS and hormone dysregulation, liver functions go off, neuropsychiatric issues, right? I mean, so that's kind of how I think of it, in my mind. And of course, all the autoimmune reactions, we find once we address the underlying inflammation, a lot of the autoimmunity does get better. Now, you yourself were mentioning you've had some autoimmune issues, right? And
Oh yeah. So I have Hashimoto's. I was a big mess following COVID and still haven't fully recovered. Have come a long ways, right? I'm holding a conversation really well. I'm not having to follow notes, it's great. My brain has come back. I'm able to exercise again. So some of those things that had really gotten compromised. But the autoimmune stuff is pervasive, and I think a lot of times it does start with the gut. But, all of these factors that are bombarding us, I'm seeing a lot of cancer showing up just like you are, in younger and younger people, or people having their second type of cancer that really isn't related to the first type. It's just, it's alarming. So anti-inflammatories are something to think about. Whatever we can do to calm down the system is going to help someone to feel better, right? So sometimes we have to try and dampen the fire a little bit while we figure out what's stoking the fire.
right.
So, things like curcumin can be really helpful. I use a lot of low-dose naltrexone. I don't know if you do as well.
Every day.
Oh, yeah.
I take it myself. So does my wife, and I tell almost every patient. And a lot of times we do it in the morning so it doesn't interfere with sleep. On an empty stomach. If they can take it at night, it's great. But no, I've been on 4.5 milligrams of LDN for years, and especially lowering down the microglial activation, knowing that it's related to Alzheimer's and neurodegenerative disease like Parkinson's. But the issue with long COVID and COVID in general, my concern for these people who've lost their smell, I mean, that this is a marker early on of neurodegenerative in certain cases. It doesn't mean that everybody loses their smell, but my concern 20 years from now, they knew with the flu epidemic in the early 20th century, Parkinson's increased after these because you get microglial activation. So LDN's perfect for it. And yeah, it's something I've used, pretty much regularly in my practice. And regarding curcumin, I use a lot of the NRF2 pathway
yeah, that's a good
activators.
one.
Yeah, so sulforaphane, curcumin, green tea extract, resveratrol. I mean, those are the 4. I'm pretty much in fact, during the Dapsone protocol, I give people NAC, alpha lipoic acid glut to block NF-kappa B. I give them those to stimulate NRF2. We use LDN, maybe a touch of melatonin at bedtime for NLRP3 inflammasome. So I agree with you. I am working as I'm trying to figure out where all the inflammation's coming from. This is a great point. I'm also working the pathways because you've got to lower down. The inflammation is ultimately what's driving the symptoms of fatigue and brain fog and pain.
Right. And dealing with that immune modulation too. So the low-dose naltrexone is going to help if there's an autoimmune tendency. Like, has someone had a positive ANA that maybe comes and goes? It's that sort of vague, not really an autoimmune issue, but something there. With ART, we find they would have a double switching. I really like thymogen alpha-1. So some of the peptides can be really helpful for that as well. Transfer factors can be good. They can be tricky as far as when you introduce those, but those can be really helpful as well for some of that bigger picture, like how do we shift them out of that Th2 dominance?
Right. Do you prefer, I mean, I use the immunotics, the 3,6 beta glucan from Zymogen is the most one I use probably most frequently for natural killer cells. But do you have a preference of when you might use beta glucan versus the transfer factors, or use both when you're looking for immune support?
Yeah. So it kind of,
I'm stumping the biochemical expert here.
No, I'm not a biochemical expert. It's just, I'm just thinking through like, okay, when does one shine? I like the beta glucans when there are more obvious gut issues going on. So if someone actually knows they feel like they are really reactive to foods, or they get really tired after meals, or those things, I've seen that being a shining star there. Where the transfer factors, like I love like a transfer factor plasmic or the L plus. If we're on the back end, like we've done our killing and now we're trying to calm that down, or the plasmic has actually been fantastic for someone who wasn't sick and then they got COVID and they're now dealing with long COVID. The plasmic can be helpful in low doses to start to kind of shift down some of that reactivation. But I tiptoe into the transfer factors. I don't have to tiptoe into the beta glucan.
I see. And the plasmic, you're talking research nutritionals?
I'm talking research nutritionals, yes.
Yeah. Yeah, they make a great line of those products. I think Debbie Hamilton, who's worked for them, did a great job of kind of getting those products out for people.
Yeah.
Yeah, so no, I agree with you. And regarding again the gut, just going back a little bit to these, because you were talking about beta glucan in the gut, because we do find so much leaky gut. We use a lot of the bovine immunoglobulins, like the mega IgG with Megaspore. We do use the spore-based probiotics, including the Probiomax 350 billion, Theralax, Saccharomyces boulardii, right? I mean, orthobiotic. We use all of them, and I haven't seen a case of C. diff. I mean, in ages. But my own leaky gut, boy, it is so much better after taking these bovine immunoglobulins. I could not eat any dark chocolate or histamine foods for a while. Pizza, I mean, I hate to admit it, but growing up in Bayside, Queens, pizza was my favorite, thing to eat. I still, as an adult, will treat myself to it, but I would have asthma attacks and have mucus all day long with congestion. I didn't know why. You'd think as a doctor, someone in medical school would have pointed out, and this is Belgium, by the way, this is a 7-year medical program with 2 years of functional biochemistry. Yeah. They just didn't give us, this as a naturopath because you get it, but I had to learn all these biochemical pathways and all these functional meta things, because once you get out in the real world, regular medicine is great. It works well in certain areas, but for these chronically ill patients,
right.
It doesn't work the same way, right? They don't have answers. They're just giving you drugs to throw at these disease states for the symptoms, but they're not unlayering the illness into the component parts, which is what you and I are doing.
Right. You have to step back and look at, okay, what's the big picture? What's going on? What is driving this? And I think even as a patient, a lot of times someone intuitively knows if they really step back and go, okay, what am I doing in my life that I could be doing differently? Like, what am I doing that's not serving myself? They're going to know, okay, I'm eating too much sugar, because they're going to notice those patterns. So sometimes it's just a little self-reflection.
Yeah. And regarding that, I mean, although we tell our patients, get on a paleo-Mediterranean autoimmune diet, get off wheat, dairy, gluten, sugar, right? You say it to people, and I know a lot of people do it, but I can tell you from my own experience, and maybe you have the same, sugar, forget it. My body will not tolerate any simple carbohydrates in general. It doesn't want it. It'll do some complex carbs, but I need a ratio of good protein, of healthy fats, and complex carbs, or my blood sugars are swinging all day long. And I'm on my treadmill exercising 20 minutes, 7 days a week at an incline for cardio. So I mean, I need a certain amount of energy from carbs, but simple carbs just isn't working. And I think people in the Lyme community, they sometimes don't realize that diet, that exercise, like the simple things of diet, exercise, sleep, the 3 big ones. Yeah. If you're not getting it right, boy, that's really impacted that inflammatory response, and you just can't get better.
Right. Absolutely.
Yeah. Yeah. So let's talk for a second about mental health. I see a lot of patients, I call them affectionately the walking wounded. I had my own abusive history when I was young. So did my wife. I mean, most people I ask, something has happened, and the mental health is definitely affecting, with the mind body of how their immune system is affecting. Are you seeing this? And what are you doing these days? I mean, I like neurofeedback techniques like Annie Hopper and Gupta, but do you have any other tricks, like when you're seeing these type of patients, what you recommend for them?
So part of it is becoming aware. If someone comes into the office and either they're calling themselves a Lyme, right? So they're identifying with the illness too much, or they are playing victim to their symptoms and not seeing a way past it. It has to be addressed, right? Because if you don't see yourself getting better, or see that there's some hope for you getting better, we could give you a magic pill and you're just not you're not ready for it. So part of it is just some of that self-talk. I really like rapid eye therapy. Annie Hopper's work is fantastic, but it's a huge time commitment, right? And so a lot of times I have only a handful of patients that are ready to do that and ready to dive in. It is very effective when you're ready to do it. But something like rapid eye therapy is very simple. It's, following some eye movements and having someone give you a script. I have names of people that I work
You're
with.
talking EMDR through like a...
Similar to EMDR. Yeah. So if you look up EMDR, it's a very similar technique.
But you have people doing it like there's a way to do it on their own with this without necessarily going...
they work with it. Like I have someone that I work with who does it via Zoom, and she's really effective that way and really inexpensive. And so that can be really helpful. The therapy can sometimes be helpful, but usually there's like a physical connection. Neural therapy can sometimes help, to release some of these things, get trapped in scar tissue. Oh my gosh, there's so many things. Sometimes body work can be really helpful too, like some craniosacral exercise, connecting through your church or with God or your spirituality, whatever that is, because part of it is, how do we let in a strength that's bigger than us? Right. And so regardless of your beliefs, like for me, my most nourishing thing is going out in nature and being away from the noise and just feeling the power of that. So, I think that's a really important piece too.
Yeah, no, it's a great point. And, and I of course discuss this with all of the patients who come in, because I think it's a point that they don't realize like how much this affects them. And, regarding chronic fatigue, even for myself, my wife would tell you she's a master astrologer, and I'm an Aquarius with an Aquarius rising, without going into too much of the detail, but I'm a 12th houser. So I don't always see myself properly, and she is a 12th houser. I need a sacred mirror, because sometimes if I'm feeling tired, it's not because I'm not eating right or exercising. It's like, it's my mood. And I'm sometimes feeling fatigue and realizing, oh, it's my mood actually that's affecting my energy level. It's not that I'm not getting enough sleep or exercising. And I don't even myself even sometimes make the connection. I need my sacred mirror to sometimes say to me, hey, honey, you just had this event and I think it's affecting you.
But I think the other thing to also notice is sometimes it's not just, our thoughts. Sometimes our thoughts are coming from these imbalances in our body, so gut imbalances, the beauty of working with kids is they have no filter, right? So what I see is like when different Clostridia species go up, it drives dopamine. They turn into little jerks. So all of a sudden, if someone, like with kids, they start biting their hand and biting their shirt and hitting the dog and hitting their siblings, that's probably a bacterial overgrowth. And it's really interesting to see you treat that. And what I see in adults is that presents as anxiety. And so a lot of times I'll look at some of those neurotransmitters or think, okay, maybe this is dopamine or quinolinic acid or something that's out of balance that's doing that. And maybe we need to look at gut health and diet and some of those things too. Yeah.
No, that's perfect. So we're getting actually close to the hour talk. I mean, are there any other specific points, things that we haven't covered that you think like would be important for people to know from the naturopathic perspective of what to do for chronic fatigue, how to address some of these resistant symptoms? Any other like important words you think you could share with people?
So I think on the hormone front, we haven't really talked about that. So adrenals, right? So if you are just wiped, you wake up and you're wiped out, you probably have low adrenal function, especially if you've been ill for any amount of time. Like that it's drawn on that. And a lot of times that could look like just fatigue during the day and sometimes a weird spike at night that you just are wound up and busy brain at night. I use a lot of adrenal glandular, so adrenal cortex, I find is incredibly important and probably one of the main things I would give to a new patient who's dealing with fatigue. It's food for the adrenals, right? So it helps to nourish that and gives you a bit of an anchor to draw from. Some of the adaptogens can be really good. Integrative Therapeutics makes HPA Adapt that I like quite a bit. I use a lot of just ashwagandha or eleutherococcus, which is also called Siberian ginseng, that helps give a boost. But addressing adrenal function, there's fancy lab testing and things you can do for that. There's like an ASI, the adrenal saliva test that you can do to give the patterns over the course of the day if you want to, or you can just do a cortisol level and a DHEA in labs, or you can just treat the adrenals and see if they feel better.
No, I agree. In fact, I run a DHEA on every patient when they first come in, and It's very rare that someone doesn't have at least phase one adrenal dysfunction going up to phase
Right.
three. And I agree with you. I use the glandulars a lot. For me, I either go to the orthomolecular adaptanol or I go to the Zymogen Adrenal Essence for the adaptogenics. I find sometimes that you're right. I mean, at night, sometimes you need phosphatidylserine. You need something to take
Absolutely.
down an overstimulated adrenal. So yeah, no, I think we're seeing the same things, which is the hormone disruption is happening in a lot of these people. And you talked about DHEA and cortisol. We didn't. I think we could finish off a little bit with pregnenolone. I'll even see pregnenolone steals right in some of these people where they're
Mhm.
using it to make adrenals. The sex hormones are dropping
Yeah.
off, right? And I
I'm
don't know
using
that the
high
doctors.
doses of pregnenolone, even in men. But, for women, I'm maybe using 100 milligrams twice a day. And in men, I'm usually, sometimes using 30 to 100 milligrams a day
Pregnenolone.
of pregnenolone. Yeah.
That's interesting because I usually have kept it on the lower side to 20 to 30 milligram. I take like 30 a day just to support my
Yeah.
hormones with some DHEA. I didn't realize, so you're not worried. You just have to follow the hormone pathways to make sure what goes into adrenal, what goes into sex. Because some women,
Right.
for example, their testosterone might go up if they have PCOS or insulin
Right.
resistance, right? You just have to follow it.
You just have to follow it and see. And usually I go based on symptoms, but higher doses of pregnenolone in men sometimes can be used for anxiety and some of these other mood disorders. So yeah, I was like you, I used really low doses, and one of the other doctors in my practice told me about these higher doses, and I found sometimes that was working quite a bit better. The
Yeah.
other thing is I'm seeing a lot of low testosterone in our men. A lot of my 20-year-old men have testosterone levels lower than my 60 and 70-year-old men. It's
Agreed.
alarming.
And that's the inflammation affecting the HPA axis, right?
Yeah.
So, years ago, I don't use regular testosterone or even beta HCG shots. I've gotten. Do you use Clomid and Arimidex, Clomifen and anastrozole? Because I found 25 milligrams, a half of a Clomifen 3 times a week, with 1 milligram of Arimidex to stop the aromatization.
Yeah.
You're right. I'm seeing the same. Men's testosterones are doubling and tripling without giving them replacement. Because if they want to have families, I don't want to suppress it by giving them exogenous testosterone.
Yeah. Yeah. I've seen some really nice things with anastrozole, and I've gotten a lot of like dirty looks from pharmacists about that. But just a half a tab, twice a week I've seen it bring testosterone levels in some men up by 400 points. It's been amazing.
Yeah.
Yeah. I do use testosterone if we're not, worried about fertility issues. I think that that's really helpful. And I use testosterone in women as well. Man, it helps with that ability to multitask and mental clarity and libido and drive and all of those things.
Right. No,
Yeah.
no, it's excellent points. So we're actually about at the 1 hour mark. So I just wanted to thank you so much. This, by the way, this was great to have these conversations back and forth, talking about nutrition and biochemistry and helping people with chronic fatigue. I think people are going to find it extremely helpful. So tell them again one more time, how can people get in touch with you? Because I'm sure they want to get in touch with you after this talk.
Yep. So Amy Dirksen at holistichealingarts.org. I'm in Seattle, Washington area, and you can just find me there.
Okay. Well, thank you again, Amy. This was great. So I want to thank everyone again for joining. My name again is Dr. Richard Horowitz. I'm co-host of the Healing from Lyme Summit. We've been with Dr. Amy Dirksen talking about solutions for chronic fatigue and looking at these really interesting biochemical pathways in chronic fatigue. So Amy, thank you so much. And I look forward to speaking to everyone soon at another episode of the Healing Lyme Summit. So thank you for joining us today.